Hello, everyone, and thank you for joining us for Medicare 101. I've got Will, my Director of Financial Planning, with me. We're going to cover some of the most common questions with Medicare and walk you through some different scenarios, some different plans, why you might consider one or the other, and then we'll also cover costs. So our goal here is to scratch the surface on Medicare, get you prepared to eventually go sit down with a Medicare expert or a licensed Medicare agent to help you. So let's jump into some of these common questions. So the first, just to get our minds focused on the cost of health insurance, an average couple age 65 years old need approximately $315,000 in retirement after tax simply to cover healthcare expenses. So this is obviously going to include your premiums for health insurance, also any out-of-pocket expenses you might have. So it takes a lot, so we have to be prepared for this. First question we get is, when should I or can I enroll? Your initial enrollment period for Medicare starts 3 months before the month you turn 65. So if you turn 65 in April, your initial enrollment period would open in January, and you have until the end of July to complete that enrollment. So obviously get started right away on this. If you know someone, great. If you need someone, reach out to us. We have some names we can share with you that can help you get going. Once you get enrolled in Medicare, then you have an annual open enrollment period that runs October 15th through December 7th every single year. So you can review your plan, make any adjustments to the plan that you need every single year, October 15th through December 7th. Will, why don't you handle what do the different plans mean?
Yeah, perfect. Thank you for that great information, Sean. Now let's jump into specifically what these plans entail, the different letters. I know they can get very, very confusing, but let's break them down here. So first we'll start with Part A. This is hospital insurance. So this helps cover inpatient care in hospitals. It does extend to skilled nursing facility care, as well as hospice care and home health care. So if you get injured, need to go to the emergency room, need to have a hospital stay, this insurance will help you out there. It's $0 a month for most individuals, and it is required that you sign up for this even before you retire. So commonly, some individuals will work beyond age 65, and they will stay on their employer-sponsored health insurance. In this case, you do still need to enroll in Medicare Part A, or you could potentially face fines. Now, Part B, medical insurance. This covers services from doctors and other healthcare providers. It covers the outpatient care, also deals with mental health, durable medical equipment if you need wheelchairs or walkers or other equipment like that. It also covers preventative services. So this is more like your employer-sponsored health insurance, which is why if you're staying on it, your employer-sponsored plan past the age you retire and you're still working past age 65, you do not need to enroll in Part B and begin paying these premiums until your employer-sponsored coverage drops off there. So a little bit about what this costs you. The deductible for Part A is $1,676 for each inpatient hospital visit. So every single time you go to the hospital or need inpatient care, you are subjected to this deductible. So that means you can pay this deductible as many times as you go into these facilities per year, which could result in a large cost to you if you don't take advantage of some of these supplemental insurance policies that we'll talk about in a little bit. As opposed to Part B, the deductible here is just $257 before Medicare starts to pay. And you'll only pay this deductible once each year. Now, it is important to note that after that deductible, there is 20% coinsurance due after that. And that's unlimited. There's no maximum amount for that on just the base level Part B plan. So you'll pay 20% of any additional dollar above that $257 limit, and that can be, virtually unlimited unless you have another supplemental policy. So let's talk about what can affect these premiums and the monthly costs associated with Medicare. You may have heard the term IRMA. before in your studies or reading when you've looked this up if you have. But that is what this surcharge is. If you make too much money in the 2 years prior to when you are going to begin paying that Medicare Part B premium, that will affect how much you pay towards that premium. So you can see we have it broken down here for single and for joint filers, but it's going to take a look back at your 2023 income. Remember, for 2025, we're going to look back 2 years to 2023. And if your income is over those ranges, you can see the surcharge to Part B there on the third column and the surcharge to Part D on the fourth column there. So this is very important to keep in mind. This is what we are analyzing when we are doing things like Roth conversions for you. And it is important to understand how these brackets can affect your total cost of healthcare and retirement. And it's important to, not intentionally go over these limits unless there's a really, really good reason to, or your plan can support it. So important to keep in mind here that, what you earn may affect what you pay as far as Medicare premiums go. Now let's get into some supplemental coverage. You heard me say supplemental coverage is very, very important. So there's kind of two main types of supplemental coverage. We'll start first with Part C, Medicare Advantage. Traditionally, these have lower premiums and higher cost sharing. They also typically bundle in the healthcare coverage with the prescription drug coverage or the Part D coverage. So these are very popular plans among individuals or families who are really healthy traditionally, as well as if you want those lower premiums month to month, and if you want a little bit less more restrictive coverage as far as in-network versus out-of-network, which we'll talk about here in just a second as well. But typically, you are restricted as far as who you can go see for care to that in-network coverage, but you do get the advantages of those lower premiums, but the deductibles could be a little higher as well. Or we could go the Medigap route with a Part D supplemental as well included. The Part D is your drug supplemental coverage, so this will help with the cost of some prescription drugs, and it may include recommended shots and vaccines in that coverage as well. With Medigap, it is kind of the opposite of that Medicare Advantage. Traditionally higher premiums, so traditionally more expensive month to month, but your deductibles are going to be a little lower. So typically this is something to look into if you expect to pay a lot in medical bills. You traditionally have a lot of prescription drugs that you are continually taking, and you visit the doctor quite a bit for coverage and care. Medigap generally does not have networks. Like I was saying, it is more open and less restrictive in terms of who you can get care from, as opposed to the Medicare Advantage. They traditionally do have networks, and this you will want to confirm with your doctor as well as your insurance provider that your doctor is in that network, so that you will be eligible for coverage and have that health insurance be able to help you out with the cost of care there.
Lots of letters going on there, Will. How would one bundle these together here?
Yeah, great question. Great question. So let's get into the different kind of options that you have. We'll start with original Medicare, which everybody is required to kind of have over age 65, plus the Medigap policies. So over here on the far left, right, the only minimum coverage that you're required to have is Part A and Part B. We would definitely not recommend that. We would recommend you pair it with at least some kind of supplemental coverage. You can see the second column here is the second option, right? Part A, Part B, and then just adding Part D, that prescription supplement, onto that policy as well. The third option is Part A, Part B with only Medigap. So this could be a good option for someone if you do not take prescription drugs and you do not foresee yourself taking prescription drugs in the future as well. However, that is a little bit risky, as sometimes things do come up that are unforeseen. And if you only have Medigap, you could be on the hook for all of the cost of those prescription drugs that you may need. So what we would recommend is that fourth option over there on the right, Part A, Part B, Part D, that prescription drug supplement as well, and Medigap to kind of round out the whole picture. If you're going with the Medigap plan, we would recommend get fully covered, just because you do not know what could happen potentially, and that's going to provide you with the most comprehensive coverage for your situation there. Next, we'll talk about original Medicare and the Medicare Advantage plans. So on the left, there usually, if you do Part A and Part B with the Medicare Advantage plan, sometimes the Medicare Advantage plans will include drug coverage. Sometimes they will not. So the two options there on the left are only either Part C with the drug coverage or Part C without the drug coverage. There is also an option to get the Part C Medicare Advantage plans that do not include the drug coverage, and then supplement that with a Part D standalone prescription supplement as well. We would typically encourage you to go with the Part A, Part B, and the Part C with the built-in drug coverage. We typically see that bundling these together can reduce the cost of the premiums of the Part D standalone prescription coverage, but it definitely depends on your unique situation, and we encourage you to work really closely with a Medicare agent to figure out which of these plans that we have just talked about fits best for your situation and your needs.
Awesome. Let's peel back the onion, dive a little bit deeper into both Medigap and Medicare Advantage, explore some different options people might have.
Yep. So the Medigap benefits are shown here on the screen. On the left side of the screen, you can see what is covered versus what is not covered in terms of what plan letter that you choose to go with. We have highlighted our favorite Medigap plan here in green, the Plan G. We find that this is the most comprehensive in nature, with the most of those check boxes clicked green. So that is a really good one to explore and ask your Medicare agent about. You can see each different benefit with your Medicare agent, see exactly which one works best for your coverage, but typically we find that the Plan G is the most comprehensive. Something important to note there of that chart is the premium amount is the only difference between these policies with the same plan letter sold by different companies. So this is regulated very, very heavily by the government. Those plan letters, Medigap is regulated very heavily by the government there. So any place that you look, as long as those letters are the same, you're going to get the same coverage as any other provider you were to go with. This is why we refer out to independent brokers that sell all different types of plans and all different types of insurers Medicare supplementals. This is how you get the best price for the best coverage that you can find. So we definitely encourage you to go independent and look at somebody who's not beholden to their company, beholden to selling their company's products.
How about Medicare Advantage? Let's take a deeper dive there.
Yeah, so let's look at two common plan options with the Medicare Advantage plans. You will see the differences in the bubbles, the HMO versus the PPO. Those numbers probably sound very, very familiar to you, as your primary health insurance through work has a couple of these different options as well. The HMO plans are going to be a little bit more restrictive. They're going to require a primary doctor, need referrals to see specialists. They're going to have no non-emergency out-of-network benefits and no out-of-network coverages. So if you're traveling a lot, the HMO plans may not be the best for you, because you are going to need to, one, make sure that that doctor you're about to go see is in coverage. And then two, if you're going to have to see anyone else like a specialist or anything, you're going to need a referral from that primary doctor before you can go see them. As opposed to the PPO plans, they don't require a primary doctor. You do not need a referral to see a specialist. Out-of-network coverage will typically cost more, but it will still be covered under some of the benefits on those PPO plans as opposed to the HMO plans. So they both do use a network of healthcare providers. They both do offer some emergency coverages, and they usually do often include Medicare drug coverages with both of these plans as well. but it's very important to understand exactly what your health plan covers and work really, really closely with your Medicare agent to determine that you have the right coverage. So some things to consider that we tell people to think about before they go talk to their Medicare agent is, how often do you go to the doctor? Should we have a plan with a higher premium and a lower deductible, or the other way around? What makes more sense for us? The other thing to know and think about is what medications do you take and the cost of those medications. Make sure we're getting the right prescription drug coverage, the right prescription drug supplemental coverage there. The next thing is, what are you able to pay each month in premiums? That is a big determining factor that you need to be aware of when signing up for this coverage. Comfortable level and ability to pay high out-of-pocket costs is another one to take into consideration. Do you have a bigger nest egg that you can pull from? Do you have an HSA plan that you've built up and saved into that you can pay, more larger out-of-pocket costs without paying any additional taxes? In that case, you may want to go with the lower premium, higher deductible type coverage there. Are you particular about your doctors and the hospitals that you're treated at? Do you have a family doctor that you've been seeing for a large portion of your life and you don't want that to change? Well, just make sure that the coverage you're about to purchase has that doctor in their network so you don't have to change who you see when you need care. Will you be traveling a significant amount in retirement? That's a big one. Make sure that we're getting the right coverage that can be transferred if we travel, or if you go vacation for half of the year in Florida, for example. Make sure that you're not limited to doctors in the Kansas City area based on what plan you have. And then finally, do you have other coverage from an employer or a retiree plan that you can potentially stay on before for a little bit, before you need to start Medicare or get those supplemental coverages taken care of? That's going to be a big one. If traditionally, if that is an option, if you have coverage that continues through work beyond age 65, it's typically cheaper than a lot of the coverages that we see from Medicare. So that's a big one as well.
Awesome. Thank you, Will. Appreciate all that good information. If anybody has specific questions, I know that's a lot, especially in this setting. Obviously reach out to us. We can try to give you some good detail. Obviously, you can find a lot of this online as well. But to our last question and the $1 million question, right? What is all of this going to cost me? Health insurance cost in retirement is bar none our greatest, question we get from our pre-retirees. It is the most, reliable unknown of every conversation. So let's unpack this a little bit for you. So we're going to both look at that Medigap plan versus that all-encompassing Medicare plan, the one that has the prescription built into Plan C. You'll see at the bottom, as Will illustrated, that this is the national average for 2025. So Will shared with us that those Medicare Advantage plans on the right-hand side are traditionally going to be much more inexpensive. We have that about $197 average per month per person. So pretty low dollar amount, but keep in mind, as Will mentioned, now we're dealing with HMO, PPO, we're dealing with networks, we're dealing with, different out-of-pocket maxes versus that Medigap plan. We're going to highlight Plan G as our, I don't know about preferred, but definitely a well-rounded recommendation to consider. You're all in at $385.50. But you have those much lower deductibles, the much lower out-of-pocket maxes. And to explore that a little bit, you also have, as Will mentioned, that national coverage. Additionally, you have some international coverage if that was to happen. But on the right-hand side, you can see, I'll make this slightly bigger, is under Medicare Advantage on the right-hand side, you see you have that maximum out-of-pocket is $9,350 per person. So hypothetically, if you did end up hitting that out-of-pocket max, that would equate to an additional $780 a month. In addition to that, obviously dealing with the networks and all of that. So both sides have pros. Both sides have some cons. The main con to the Medigap with the Plan G is that the monthly premium is a little bit higher. But we feel that, if you've handled your business preparing for retirement and have a good stable plan heading into retirement day, that we definitely would have you look at and consider that Medigap plan. And the reason why is when we're building plans and when we're talking to people, the Medicare Advantage has a much lower floor, if you will, right? It's much cheaper, right? Medigap has a higher floor, but Medigap has a much lower ceiling, right? What you could end up spending in total is much lower than, what the total could end up being in a Medicare Advantage plan. So Will is building financial plans for us. We know we like some sense of predictability and some comfort of what the worst case scenario could be. A lot of times we build our plans around those worst case scenarios. So being able to lower your ceiling with a Medigap plan is certainly something to consider there. So lastly, we certainly appreciate you joining us. We hope this has been educational in some capacity. As mentioned, reach out to us if you have any specific questions. Obviously, we can get you in touch with a local agent as well that can help you take the next level. As far as where we can help you from here, if you're not signed up for Medicare yet, we have an alert in our system. Every client that turns 64, we're going to shoot you an email within a few weeks of turning 64, kind of giving you a Medicare 101 breakdown. At 64 and a half, we'll send you another one, preparing for that initial enrollment period. As a reminder, that starts 3 months before the month you turn 65. So we'll send you another email when your initial enrollment period opens, informing you that it's time to get that ball rolling. So feel free to ignore everything that's coming to your email and your text and your mailbox surrounding signing up for Medicare. We can help you. We can guide you, keep it clean and keep it simple. So appreciate the time. Will, feel like I missed anything?
I don't think so. I think we covered it all. That was a really good point. We will be here to guide you if you have any questions. We know it is a confusing time for some, but it's really just confusing because it's brand new, right? You guys have never done this before, but working with individuals that have, it does become a lot easier. So do not hesitate to reach out to us. We'd be happy to help.
Yeah, great point. Thanks, Will. Thanks, everybody, for joining us, and we'll talk to you all very soon.